This is a very low-key group. You don't need paper, you don't need pens. If you want them, you're welcome to have them. You'll see that there are resistance bands on the chairs. We are doing a lot more moving and a lot less talking in this class. A little more comfortable moving than I am talking in front of people. So again, thank you guys so much for being here. It's a big title for what should be a simple concept, but simple is not always easy. So yeah, recovery, restoration, and renewal, the power of movement. The benefits of movement and exercise during and after cancer. Again, that sounds simple, not always easy. So I'll give you a little rundown of today's plan. We're going to discuss the positive effects of exercise and movement in general and during and after cancer treatments. We're going to participate as you see fit in a guided group exercise experience. And then we'll have some time at the end for questions and answers. And I do have my resources at the list at the end. We can go ahead and review. I'll answer questions to the best of my ability. If you ask questions that I do not have the answer to, my email will be in the presentation that will be up for BACC on their website in a couple of weeks. But I'm happy to come find me after the presentation. I'm happy to give you my email. If you have questions and I cannot answer them today, I will get information to you. If I don't have the answer, I will do my best to connect you with someone who can give you the answer you're looking for, or at least the resources to find it. All right, so positive benefits of exercise. We have a few up here. Can anybody think of anything other than increased energy, improved sleep, as far as physical benefits? Anybody else have any other? I think those encompass a lot of what we're looking for when we think about exercise, maybe strength, which means different things to different people, right? Improved sleep. When we sleep, we heal. It's wonderful, and it's amazing to think that being active can actually help us quiet our bodies down and let our brain do its work later on. Mental and benefits in terms of pain. We get improved mood and reduction in chronic pain. Those are both associated and correlated with increase in being physically active. And exercise means different things to different people. So any level of physical activity, there's very, very good evidence that we can see improved mood and reduction in chronic pain. Cancer-wise, we know through lots of literature, lots of studies that have been done, and I'll allude to a few later on when we talk a little bit more, that there are improvements in quality of life, positive correlation of exercise with a reduction in cancer-related fatigue. Fatigue in general in the general population, but cancer-related fatigue in particular. There's very strong evidence that we can reduce this with physical activity. Anxiety and depression also. This also goes along with the mood improvements that we can see in the general population who chooses to be physically active. Exercising helps us manage side effects, so we can maintain muscle mass, we can maintain bone density and improve bone density, and also reduce the deleterious effects of the drugs, the chemo drugs and radiation that many clients have to undergo when treating cancer. Okay, and exercise, there's strong evidence that exercise may improve survival outcomes and reduce risk of recurrence. Okay, any questions so far? Oh, I thought I saw a hand there. Okay.
Yeah.
Oh, yeah.
If you're caught in cancer-related fatigue, try to break out and bring exercise in after you're already caught in the downward spiral. What are, you got some good strategies for trying to pull that in once you're caught?
Yeah, I think, we can definitely talk about that. I'm happy to talk about this during the question and answer portion. In general, yes, low and slow is kind of the mantra for that. Doing what you can. Every step makes a difference. So 5 steps is better than 0 steps. And listening to your body is very, very important. But yeah, that's a super, super good question. And if other people have input on this later, I think we definitely could discuss this during our question and answer section. But thank you so much for bringing that up. Yeah. Anybody else? Okay. All right. Okay, some key evidence and guidelines. We're going to talk a little bit about studies that have been done, just very briefly, studies that have been done related to the effect of exercise on the cancer journey as well as with the general public. Okay, so walking and survival. There was a landmark study done by Holmes et al. It was published in JAMA back in 2005, so 20 years ago. And I find it really fascinating. We didn't know this, definitively when I finished school, but so it's came up, in the last 20 years. This study did show, it was the first one that showed almost definitively that walking 2 to 3 miles per hour, so faster was not necessarily better, for a total of 3 to 5 hours per week correlated with reduced recurrence and improved survival after breast cancer diagnosis and treatment. So improvement in quality of life was really what they were looking for here. And the 2 to 3 miles per hour, I think that was what a lot of us found very interesting, because we know from other studies that interval training is important. Interval training, it's all relative. So depending on what your level of activity is, what your energy level is, we can kind of tailor this to the individual and know that any amount of steps that you can take 2 to 3 hours, 3 hours a week, 3 to 5 hours a week walking will make a positive, have a positive effect. Yes?
What pace is 2 to 3 miles?
2 to 3 miles per hour, that would be like a 20 to 30 minute mile. Yeah. So, and if you look at, we'll talk about Health and Human Services guidelines for physical activity. If we look at what they're recommending, there's a parallel between the general population and the population who's in treatment or post-treatment for cancer. Okay. And as far as post-operative rehab, I'm an orthopedic trained physical therapist, and the shoulder and neck was kind of my jam before all of this. And when I got involved in the world of breast cancer specifically, it was kind of my entry into the oncologic world. I found this very validating for all the stuff that we knew kind of in orthopedics. Breast cancer patients were shown in this 2025 meta-analysis done by Xu et al. That there was significant improvement in shoulder and upper body functioning in clients who engaged in regular physical activity. So that could have been the walking, that could be aerobics, that could be any other kind of aerobics, it could be interval training, Pilates, yoga, strength training, and any kind of cardiovascular activity. So it wasn't necessarily just surviving, it wasn't necessarily pushing past treatment, it was serious improvement in function, so range of motion, strength, and all of that sort of thing. So that was just more kind of fodder in my tool belt to encourage people to keep moving however they can. Okay. And if we move on to what the general population, recommendations for the general populations are, back in 2018, the Department of Health and Human Services published updated activity guidelines for the general population. And 150 minutes a week for, which means basically 3 to 5 days per week was what was recommended for the general population. Moderate intensity, so brisk walking, interval training, cardio of any sort, biking, swimming, anything with like rhythmic motions has been recommended to help keep people's quality of life good just in the general population. If we look at what the walking recommendations were for the breast cancer population in specific, it's pretty closely parallels this. So if we're thinking, and if you look at that 2 to 3 miles per hour, maybe for somebody who has not undergone any sort of a treatment that might affect their physical functioning, whether it's through cardiotoxicity or anything like that, 2 to 3 miles per hour could definitely fall into that brisk category, right? So if you can carry on a conversation but you couldn't sing a song, that's what we're looking for even for our general population. Any additions or questions for now on that? Okay. All right. And then we throw strength and flexibility, or we strategically place, not throw, strength and flexibility recommendations in. So the HHS recommendations for strength training, 2 to 3 days per week, with the intensity of 8 to 15 reps, 1 to 3 sets, depending on the weight that you're putting someone's muscles, the load that you're putting someone under. We're looking at major muscle groups, legs, back, chest. So you're thinking about, if you think about in the physical activity, the population that's doing powerlifting, they're doing deadlifts, picking things up off the floor. Maybe we're moving heavy boxes around our house, same thing. We're doing bench presses, or maybe we're pushing open heavy doors by walking around, buildings and doing what we need to do in our daily life, whether it's function or weights, resistance bands, body weight activity. It all is part and parcel of the same thing. And we're seeing good evidence at this point that strength training in the cancer population and in the survivor population is having positive correlations with not only bone density improvements, lymphedema reduction, which is a kind of a 180-degree flip from what we used to tell people, that lifting heavy is actually very, very good to reduce your risk for a lot of issues that go along with post-cancer treatments. Yeah, and then if we look at flexibility, working 2 to 3 plus days per week, so a little bit every day tends to be very good, and to help people maintain flexibility, general population and the cancer survivor population. We want to stretch to the point of mild tension, and we'll go through some of these activities when we start to move in just a couple of minutes. And we're thinking about major muscle groups, so we're thinking chest, arms, back, legs, any or all of the above. And if we think about the population who's had surgeries or radiation or any kind of treatment that can affect your tissue integrity, we may modify these exercises to ensure that people will be successful with what they're doing. So it's not necessarily one size fit all, but the recommendation does encompass a lot of the things that we do with the oncology population as well as the general population. So, okay. All right. So common barriers to exercise, and I think this alludes to what you were talking earlier about cancer-related fatigue. Start low, go slow. Start low, stay slow. I mean, I think listening to your body is basically the biggest thing that we can encourage people to do, both in the general population and in a situation where people have undergone treatment or are currently in treatment. If you are scared, if you are hurting, there's a lot of things that go into this. A lot of things can go into pain. A lot of things can limit our not necessarily desire to move, but our ability to actually get going on some sort of exercise program. Find a PT. Your local physical therapist will be able to help you. If they in particular feel that they're not the person for you, PT is a small community. We all know each other. It's a very large community, small world. We all have a connection, and we can find resources that will help you get started. Even if sometimes it's just a gentle nudge in the right direction. Sometimes it's actually saying, hey, I'm really concerned. I'm really worried about, this one issue that I have. Asking for help is hard, but getting the help is not hard once you're there. So the resources are out there, and physical therapists are willing and happy to help. Even if it's pointing you to a trainer or pointing you to an online program, we can help you. Yes.
How important is it to find a physical therapist who knows in particular about breast cancer?
Okay.
Treatment, and issues.
Yeah, I think, speaking from, just my own personal bias, I think it's a very good idea to ask if somebody has experience with breast cancer. Asking about breast cancer, if you cannot find someone who has experience with breast cancer, I think in this area we're very lucky. There are a lot of us who, unfortunately, or for one reason or another, have been affected by it. But I would say if you can, it's not absolutely essential, but if you can, I would try to find somebody who's experienced with it, just because of the sequelae of treatment. So if you're looking at a lymphedema risk or experience a lot of cancer-related fatigue, I think that's the situation where it would be a really good idea to find somebody who does have experience with the population. So is that helpful? Yeah, but in the case that you can't, I would say find a PT and move and go from there, because again, PTs have resources to find you somebody. If they don't feel that they're the right fit for you, they'll be able to find you somebody who is, or point you in the right direction. Yeah.
And I just say, if you're working with someone who doesn't understand breast cancer, be your own advocate.
Yes.
Do your research, and when they ask you to do something, say, I don't think that works for me, because.
I think that's a very, very solid point. And if you're not, sometimes it's hard to start. Once you start advocating for yourself, it's a little bit easier to go there. But I would agree with you. So yeah.
Oncologists can recommend physical therapists who have breast cancer experience and lymphedema experience. Okay.
Very good. Thank you. Yeah. Okay. Motivation and mood, if it's hard to get started, you've gotten past the barrier of being scared to do it, but it's hard to get started, put it in your phone, put it in your planner. Make a date for exercise, whether it's with yourself or with a partner or a group. I have found in my clients, most of my clients have found that that's probably the easiest way to do it, is set a time and start low, start slow. Once a week, 20 minutes is a very effective way to get going, okay? Or finding resources through a cancer advocacy organization, through BACC, through Women's Cancer Resource Center. There's areas like that all over, or organizations like this all over the country that are very, very willing and very able to point you toward people who will help you motivate to get started. Okay, and medical concerns, that's another common barrier that we do see. Neuropathy, lymphedema, nausea, fatigue that we've talked about earlier. We do want to make sure that people are adapting, either adapting their exercises to how they're feeling at any particular point in time. Every day is a new adventure. So adapting the exercise to what you feel like you can handle on any particular day, and it might be different today versus tomorrow, is very important. Something to consider is that research the research is ongoing and evidence is changing, and we're seeing things change fairly quickly in the research world. Even 2 to 5 years, we're seeing differences in recommendations. So guidelines previously, which were showing that lymphedema, it's not great to lift heavy weights. Now we're seeing, again, start low, go slow. We can get people lifting whatever they want to be lifting. It just takes time, and it takes adapting and listening to your body, and being with instructors who understand what's going on. Okay, and recent studies do show that exercise correlates with reduction in all of these symptoms. So that's something that is important to consider. But again, if you're afraid to get started, talk to a PT, talk to your oncologist, talk to your general practitioner, whoever you have a good relationship in that you feel can point you in the right direction. Ask your questions and advocate. Okay, yeah.
I just wanted to mention that at UCSF, where I'm a patient at, they do have physical therapists who specialize in working with breast cancer patients, as well as with those with lymphedema. The lymphedema PT works out of it's a new location on, I think it's Visadero, St. Mary's Hospital, and then UCSF Bayfront. It's across from Mission. It's basically Mission Bay, but it's the new Bayfront building. Jill Gleason is her name. She's great.
Excellent.
So she works strictly with, strengthening exercises with breast cancer patients, and she's a doctor.
That's excellent. Yes, and
Sutter Health has it
yes.
as well, and this area.
Yep, Sutter Health, they've got a really strong breast health and just pelvic health, both department. Yeah, Stanford as well. Yes.
I just kind of want to offer another perspective on exercise, although I think it's really, really important. And I think for someone that's used to it and having had it, if you've had an exercise practice in your life, then continuing it in a modified way, yes, if you have cancer. But I think there's also like some patients from what I've experienced. I'm a social worker. Feel shamed if they can't, if they're not up for it, if they have other obligations. Their doctors are telling them you need to be doing this, and it's kind of like they don't feel like they can for various reasons. And so I don't know, I have like a mixed feeling about it. I know that it is great, like that, but I hear a lot of patients say, oh, I should be doing this, but they're managing so many other things at the same time. So I just kind of wanted to put it out there as another barrier, because it's reality that like not everyone can just like integrate this.
I think that's a really important thing to bring up, and thank you so much for bringing that up. I think that's why the studies that have been that have been in the forefront of my mind have talked about just the cumulative effect of all physical activity, not just specifically exercising. I think that's a super solid point to make. The accumulation of steps, the accumulation of any amount of physical activity during a day, it goes toward those numbers, towards the recommendations. I think that's super important, because it is tough for many people to get going. And I think you're right, it's probably very intimidating for some people to say, okay, I'm going to join this class. Yeah, and I think that's a very important barrier to add in, and I think I will update my slides when I speak again. So thank you. What's your name?
I'm Erin.
Erin, thank you so much for speaking up. I appreciate that. Yeah. Anybody else have any comments before we move on? Yeah.
Well, I was just going to mention that BACC offers online exercise
Yes.
programs, so people, when they're ready, can do that from the it's on Zoom.
Yes.
From their home and
Yes.
stay as long as they want. Don't have to go anywhere.
Yes, and you don't have to show yourself on camera. You are welcome to, and you can show up and listen from your bed. I think that's a super solid point, and BACC has done a really good job of trying to make everything as accessible as possible. Yeah. So, all right.
I had a friend who was bedridden for 2 years, and she danced every day in her bed. And when she was able to get up, she had the specialist come and she says, how do you have this muscle tone? And she says, I've danced for the last 2 years.
Love it. I love it. And imagine what it's done for her mental
Right.
outlook
So
as well.
even if you can't get out of bed, you can still engage your muscles.
I love that. I think that's a super important thing to bring up. All right. Anything else before we move on? Okay. Okay. So adding on to the safety first, we want to think about precautions, when to exercise. So movement, great. You move when you can. When you're ready to start, if and when you're ready to start an exercise program, please get medical clearance. You want to talk to your doctors and make sure that they're okay with everything that you are intending to start with. Warm up and cool down are essential. Hydrating well. Please listen to your body and please don't push through sharp pain. If you do have sharp pain, please talk to your trusted professional, whether it's your physician, whether it's your physical therapist, whether it's your exercise instructor, and they can point you in a direction to either modify or say, hey, look, we got to check this out. Okay, and when to stop and consult, just we would give this advice to the general population as well. Chest pain, dizziness, unusual shortness of breath. If you do have a fever or an acute infection or a change in your status, please hold off, consult your provider. And just be aware of changes, so new unexplained pain, new swelling, anything, if it's in the back of your head, please ask. Okay? All right, and our healthcare team's role, this really is a team effort. We have physicians, physical therapists, and then you as the patient, the survivor, the family member of somebody who is in treatment. Please work together. You can read what it says on the slides, but as our friend up front here said, please advocate for your needs. If you're having trouble getting going, ask your doctor, ask your physical therapist, ask your friends. Just if there's different ways, different things that we can brainstorm to get you moving again. Okay. All right, so we're gonna move. Okay? Yes, thank you. So I'm gonna have everybody, we're gonna start in sitting and we're gonna get ourselves moving a little bit, and my disclaimer is you move as much or as little as you feel appropriate for your situation right now. We have resistance bands on the chairs. If you'd like to use it, you're welcome to. If you want to leave that alone and just move your body, that is perfectly fine. Again, please work in a manner that makes sense for you and that makes you feel safe. Okay? So we're gonna start sitting. Gonna have everybody, this is gonna kind of bring back memories of a little bit of the Dr. Gregg's talk this morning. So we're gonna start sitting down in our chairs with our feet right underneath our knees. I want you to bring your hands right to the front of your thighs. Okay, and if you feel safe closing your eyes, please do so. Okay, we're gonna imagine there's a string pulling the crown of the head up to the ceiling, and we're gonna imagine that string is coming right through the center of the body, dropping a little plumb line between your tailbones, through that chair and all the way through to the floor. Let's breathe in, let our rib cage open up, and breathe out. Let that rib cage draw back down to that midline. One more time, big breath in. Breathing out, we're gonna draw the belly and spine toward each other. Imagine there's a little seatbelt of muscles connecting around your midsection. Can we take a big breath in with those seatbelt muscles still engaging? Feel those ribs open up again. Exhale through your mouth. Nice big breath. Blow the air out like you're blowing your birthday candles out. And then let everything go, and we're going to sit nice and quietly. I want you to be aware of your sit bones on that chair. Wiggle around a little bit. Put your weight between the two of them. Go back and forth. Quiet those sit bones down. Scrunch your toes up in your shoes. Feel them scrunch back toward your heels. Feel those arches lift. Notice any sensations that may or may not be going on in your feet. Spread those toes away from each other and let them release down into the floor. Let's bring our hands down by our sides now. And we're going to lift one leg up off that chair. Float it up. Breathe it in. Exhale, float that foot down. Inhale, we float our other knee up. And exhale, we float it down. Let's march back and forth. Lifting and lowering one leg at a time. If you feel safe doing so, take your hands right to your midsection. Do we feel anything moving in that midsection? Yes or no, both are incredibly appropriate answers right now. Yeah. When we laugh, do we feel anything going on in our midsection? That's good. Go ahead and open your eyes if they've been closed. We're going to float that second foot down to the floor. Bring the hands down by the sides. Let's take a big breath in. And breathing out, let's rise to our feet. Shift your trunk over those knees. Press your feet into the floor, and let's stand up nice and tall. All right. Let's grab onto those resistance bands if you'd like to use them. We're going to hold that band either doubled up or just hold one portion of it. We got different options for resistance. If you'd like no resistance, put that band right back down. Okay, we're going to get our hands shoulder width apart, and we're going to pull the slack out of that loop. So not much tension. We're going to feel a little activity in those arms. Let's take a big breath in, and as we exhale, let's take those arms all the way up overhead. Big breath out. Yes. Let's bring the arms forward and then down by the thighs. If you have that band in your hands, go ahead and gently press into your thighs and squeeze those blades together. Big breath in, those arms come up and overhead. We exhale them forward, down by the body, and squeeze those blades, pressing the hands back. One more time, big breath in, those arms come up overhead. Holding the arms there, we're going to let those shoulder blades drop down the back sides of the body. Hold it here. Can we again engage those seatbelt muscles, draw belly to spine? Let's take a nice tall side bend toward the top side of each wall. Inhale up and exhale over. Swaying side to side like we're a little tree swaying in the breeze. Feel the length through the sides of the trunk. Feel the length through the sides of those armpits. One more time, we sway over to one side. Inhale up to the ceiling, and breathing out, we come over to the other side one more time. Let's bring our arms up and overhead. And then exhaling, we bring everything down by the body. Okay, if you're holding that loop, we're going to take it behind our body. We're going to turn our palms facing forward, thumbs face out to the sides. Soften up those elbows. We're going to keep them from locking out. And I want you to think about widening your collarbones. Take them away from the center of the body so the shoulders pop out toward our side walls. We're going to get a little stretch through the chest here. We go at a level that feels comfortable for you. And if you are holding that band, we're going to gently press the back of the band into our thighs or our rear ends, wherever we are. Let's hold here. Feel those biceps engage a little bit, the front of the arms. We're going to give those arms a little pulse forward to the wall in front of us. We're going to pulse for 4, 3, 2, and 1. Hold here for a big breath. And then breathing out, we let go of that loop. We can place it back on our chairs if we've been holding it. And we're going to shake those arms out. Okay. Fingertips are going to come to the front of the waistline, and our thumbs are going to come to the back of the waistline. Get those hands settled nice and comfortably, and we're going to get our feet hip width apart. Let's again send the crown of the head up to the ceiling. Big breath in, and breathing out, we draw belly and spine toward each other. Okay, let's shift our weight toward our toes and toward our heels. Let's shift forward and back and see if we can find the range where we keep our toes and our heels on the floor as we shift. So it's just a little bit forward and a little bit back. What's going on underneath your fingertips? Do you feel those abdominal muscles working a little bit or moving a little bit? Okay. Good. Let's shift back over the front of our ankle joints And moving in one line from the ankle to the crown of the head, we're going to shift side to side. Do we feel those muscles kicking into our fingertips a little bit more? Yeah. So gravity and physics are helping us get an abdominal workout, and I'm not joking here. So it doesn't take a ton to get those muscles moving. Let's make little circles around our base of support. Draw a circle on the ceiling with the crown of your head. Do we feel those muscles engaging a little bit differently depending on where we are? Yeah. Pause, and then let's take that circle the other way. All right. We'll circle for 3. We'll circle for 2. And we'll circle for 1. All right, let's come right back over those ankles. Shake out your knees. Pause that body, shake out your wrists. All right. We're going to go ahead and walk behind. I want you to see if you, is there room in that back row? Is there room to be behind those chairs? Okay, awesome. If you were in the front row, if you want to walk behind and we're going to use the back of our chair as a little bit of a balance assist there. We're going to finish up the movement experience with just a touch of balance work. Okay, and we have a few options here. So let's stand up nice and tall. Yeah. Wherever you can. Make sure you guys just got something to hold on to. Okay, so we're gonna put our fingertips on the chair backs. Yeah, they're just the back of the chair. No big deal. Yeah. All right. Feet are gonna be a little bit narrower than our hips. Okay, we're gonna bring them almost together. I want you to use your fingertips on that chair back to help keep you supported if you need it. Let's shift forward toward our toes, and we're gonna go up and down on those toes. Lift and lower the heels, keeping the weight over the balls of your feet. Feel your calves engage. Yeah. Maybe we feel those hamstrings doing a little bit of work. Maybe we feel our glutes doing a little bit of work. We're going to take it up and down for 3, for 2, for 1. Lower your heels. Let's shift our weight to 1 foot. We're going to first go up onto the tiptoes of the other side. And then if you feel safe there, we're going to rise that foot up off the floor. Hold it here for 4, for 3, for 2. And for 1, let's float that foot down. We're going to switch sides, shift the weight, come up to the tiptoes. Lift that foot up if you feel safe doing so. Hold it for 4, 3, 2, and 1. Those feet come down, arms and legs come down. We shake everything out. All right, let's bring our feet hip width apart. We're going to close here. We're going to take a big breath in, sweep those arms up and overhead. Take a side bend to one side of the room. Inhale up tall, and then breathing out, we take a side bend the other way. Inhale up tall, let's look up to those fingertips, press those palms together, and we breathe everything into center. All right. Thank you so much for moving with me, and thank you for listening to me, and thank you for your contributions. I really appreciate this, and I hope everyone enjoys the rest of their conference. Okay. Thank you so much. Yeah. No, it's okay. We kind of did questions. We're good. Yeah.
So we could have, I'm sorry.
We're okay. Yeah. Yeah, of course. If you guys have questions, we do have a little bit more time. Oh, we do? Yeah, for questions. If you do. Not a one-on-one. Yeah. Oh, hang tight. Yeah. Yes.
Like if there's been any research on ways to, I mean, you have some good tips for like motivating yourself. But
Sure.
like motivating through social connections or, I don't know if I've left enough questions.
Okay, that's okay. That's a good question. I can, you know what, I can look into it and let you know. I know that there's a whole psychosocial work world for all of this stuff. Yeah, there is, I know that there is literature. I can't cite specific studies for you, but it is really, I think the social aspect of it is huge as a motivating factor. Yeah, let me.
Did she want research or just tips?
That's a good question. Do you want research or just tips? That's a very good question.
Like tips for people in my life that I would like to.
Oh, good question. Tips for people in your life
Without nagging.
without nagging to. Oh, that's a good question. That's a very, very good question. Gosh. You know, that's a really good question. As far as literature, I don't have an answer for you. As far as motivation, open-ended questions are probably a really good place to start. So questions, what would you think of? I mean, I would think of something like, what are you hoping to get out of this? What do you think is, if we tell you, we were telling you to exercise, what do you think you'll get out of exercise? Something like that. Or what would motivate you?
What would happen if you didn't
What would happen? That's a good question. That's a really good question. I would say open-ended questions are probably where I would start.